everyone. My name's Ellen and this is Lesley.
Hi.
We're from the Integrated Wellness Clinic at Mooloolaba and we both work at Caloundra Clinic as well. Today we're going to be talking about parasites and all about gut health and how parasites can be affecting gut health and other kinds of things that it can be affecting as well. So Lesley is a naturopath at the clinic who specialises in gut health and lots of different kinds of gut disorders. So I thought that we'd steal her from her consults today and have a chat to her. So Lesley, first thing first, what kinds of symptoms would you normally notice with parasites and where could people possibly pick them up? Two questions in one.
So that can be quite tricky because parasites can give you like gut symptoms, typical gut symptoms like diarrhea or constipation or tummy cramps and pain and that sort of thing. It can be your typical itchy bottom, that sort of thing. Or you could have totally unrelated, seemingly unrelated symptoms like an itchy nose, itchy eyes, allergies, mucus, because those parasites cause the immune system to respond in a certain way that produces a lot of mucus. So then wherever there's mucus in the body, you get lots of mucus. So you can even have rashes and pruritus. Yeah.
And what about mental health things or fatigue, anything like that that you notice?
Especially like a foggy brain, that sort of thing. And I've noticed for some reason, particularly in men, anxiety seems to come hand in hand with parasites. A lot of anxiety and depression symptoms clear up when parasites are treated. So lots of brain and mood type symptoms, and especially with your kids, you see them go through like the young ones going through tantrums and naughty behaviour when really it's just symptoms of parasites.
When there's not anything going on environmentally. Yeah, interesting. And what about where people might pick these things up? So obviously barley belly, that kind of thing. Yeah. Would be a big one.
So a lot of them can be, like you're saying, overseas, in foods, and that sort of thing. But even just like blasto you can get from just scratching yourself in the garden. It's in the soil, it's on plants, in foods. Obviously the fecal matter, so even just from door handles and things like that, just from not being very hygienic or that sort of thing.
I guess in those kinds of countries also when you're travelling, places like South America or India, places like that too, where the hygiene standards aren't up to what we're used to as well, and that our immune system won't cope with it.
That's it.
Interesting. And what about specific kinds of parasites that you see commonly in clinic?
So a really, really common one is Blastocystis hominis, or blasto as we call it. And another one is Dientamoeba fragilis. And then you've got your Giardia, your Cryptosporidium, that sort of thing. There's so many. Yeah.
And they can go hand in hand as well. It can be one or it can be multiple ones.
Yeah. And that's the thing. Once you've got one, the environment becomes like the parasite to survive will bring down the immune system, so the environment becomes perfect for other bacterias and yeasts and things to take over. So
not just parasites as well. So through the doctor you can do the PCR test through Medicare, but what other kinds of options is there for testing for parasites?
Yeah, so a complete digestive stool analysis test is a good place to start. So that will take a sample of your fecal matter and it will put it on a slide, and they'll physically look for eggs and for the parasite itself, and then like you were saying PCR, so they're testing actually then for DNA, which is really good because the PCR test can they can miss the physical detection because it only takes a very tiny amount of the stool sample, whereas the PCR test is testing for the DNA, so if it's even been there in the last 4 months, it's going to detect it, and they can give you levels as to how badly you're affected.
If it's just DNA or if it's active or if it's not super active.
That's it.
Okay. And what about If you have any questions for Lesley or I, just comment in the comment section and we'll answer you. And what about treatment for parasites and for gut dysbiosis like that, Lesley?
We have some lovely yummy herbs for that. Unfortunately, or unfortunately, a lot of the herbs that we use for treating parasites are some of the worst tasting herbs. So we have some really good herbal formulas in tablet form to avoid you having to taste those. But yeah, there's some wonderful herbs like Chinese wormwood, I can't think, like Artemisia,
Nigella.
Yeah, Nigella, black walnut. There's quite a few, and even things like cumin, black cumin seeds, even onions, garlic, all of that sort of thing. Yeah, they're really, really good for
very nice medicine.
Yeah. Pawpaw's great.
Oh,
yeah,
that's a good one.
Yeah, so yeah, there's lots of things we can do, both nutritionally and medicinally, herbally, to treat them.
Sounds good.
And also we want to starve them of their foods as well, so we change the diet and help you with lifestyle, so you're not getting them again in future,
getting prone to it again,
and or reinfecting yourself, because you can pass them back to yourself through your nose or your ears or your eyes even. So
well, you hear of the whole family getting it, right? Because it just goes around the whole family and everyone gets infected, and tries the parasite cleanse, but I suppose doing something more specific for what parasite you have, or the whole immune system function can be much more.
Because why did you get it in the first place? You've got to deal with them. Why was my body not able to fight this off just with it passing through? So you've got to look at the cause and alleviate the symptoms and treat the bad guy, but address the cause as well.
Yes. Great. Okay, thank you, Lesley, for giving us your insight. If anyone has any questions, please feel free to comment in the comment section below and we'll get back to you. But have a great day. Bye.